Well, it's time now to focus on your family and help as they age. Today we're talking about non-medical home care with Carolyn Richardson, a PACE guide to senior living, and Audrey Sharif, a PACE sponsor from Doves. Good to see you both.
Thank you.
Carolyn, let's start with you. What is non-medical home care?
Well, it kind of gets confused. We hear of the word home care and we hear of home health. And I want to kind of make that distinction. Home health is those services that you get that provides a nurse and physical therapy. Home care is more of your supportive services in the home with caregivers coming in to help with activities of daily living and really helping support the person so they can stay home independently for as long as possible.
Well, and you mentioned a couple, but what are some of the services that you provide?
Well, it's a broad range, but mostly things like transportation to maybe doctor's appointments, tidying up, doing meal prep, actually helping patients eat, maybe doing more one-on-one care where they're helping get dressed in the morning, get ready for the day, helping them get to bed, helping clean their house, and really assist in all their activities of daily living so they can maintain their independence in home as long as possible.
Oh, I think that's fantastic. And Audrey, you were saying that encouragement is a big part of this too. What makes Doves a unique home care company?
I really feel our caregivers are very compassionate. They've been with me I've got many of them that have been with us for years. They bring their family members that are caregivers and CNAs, and we have an outstanding group of very compassionate, caring, knowledgeable staff. But when our staff is in there with a family member or with a patient, they can understand what their baseline is, understand what their routine is. But if they start picking up on something that maybe they're getting weaker or maybe something's going on, they don't have to diagnose it, but they just need to be able to pick up the phone. And Centrix is a large enough organization to where they can call me, and then we can get them the added safety measures in place to keep them from going back and forth to the hospital. When I go out there and I do the assessment in their home, I'm troubleshooting, trying to find safety measures and things that maybe it's the hall light, or if they're getting up in the bathroom at night, or making sure that they've got grab bars in the right places to where even if we're not in the home continuously, if they can only have us in for a few hours, we want to have things in there then to where they're still going to succeed and be safe when we are gone.
Well, I like that too, because maybe the family member's not the best person in that capacity, because you get used to it. It's something that you don't see, or you're when you're with somebody every single day. So I think that's awesome. I would be curious to know what your clients say are the biggest benefits of home care.
Well, we have different families have different dynamics. So I've got I know a lot of ladies, they miss their visit. If they want Denise, I miss Denise. They get that companionship going. It's a friend that's coming in to see them maybe 2 or 3 times a week. But that may be their only interaction that they have throughout the week. So some people really need that. Others, it might be a family member who's the full-time caregiver, and they just have us come out to give them a break.
Exactly.
Maybe they want to do some shopping, and so it's not so much for the client, it's more for the family members to give themselves downtime to where they can regroup or get some things done that they need to be
right. And PACE coordinators can help.
Absolutely. So at any point, if this is of interest, we have PACE coordinators waiting to answer your call, to help assess and get you connected with a company like Doves. And we are also giving away this Doves Lasting Step Guide. I'll let Audrey tell you a little bit about it. She created it, and we're giving it away to anybody who calls into PACE today.
And it's a great guide, and they just have to pick up the phone and call you, right?
Yep, and it can be used as a journal for a lot of times when they're in facilities and they're going home.
Perfect. Excellent. Thank you. For more information, everyone, visit seniorhousing.org or call that number right there on your screen.